things that we don't think of normally as metabolic are metabolic. Things like schizophrenia. 75% of schizophrenia is a metabolic problem. And these people quit hearing voices once you fix their metabolism. And I know that that's a generic term, but I'm going to dig into it so you can see what I mean by that. Can you see my slides while I treat metabolic inflammation?
Yes.
Okay, good. Perfect. So I'm at a pain conference. I'm just pulling up the last slide set that I did. And there's a bizarre definition of pain, but it's relevant for you because about 50% of your patients will have some form of polyjoint arthralgia or other symptom. It may be even higher. And there's all kinds of bizarre definitions, but and they're long, but that's not my definition. IASP has this long 6-part definition. That's not mine. My definition is pain is when your body starts screaming that something has gone wrong and it doesn't know what to do. And it says, hey, something's gone wrong. You better fix it. It's the signal that says something is terrible. And when you get to that level, it's a problem. And it just so happens that those pathways are overlapping pathways with obesity, pain, addiction. Those are all common pathways for metabolic inflammation. When you look at Medicare, they're looking at at healthcare delivery, and they know that when people are born, they consume a little bit of healthcare resources, they become neutral, and then they become productive in society, and they produce resources for society. As they age out, they become senescent, and as they become senescent, they consume resources. Now, Medicare is paying attention to this and has come up with a way to ask physicians to increase health span, which is keep these people as healthy as long as you can and do it with a lifestyle modality. So in 2023, they kicked in a bunch of lifestyle modality codes that they never had before. And those lifestyle modality codes allow us to bill 26 times a year by telemed lifestyle coaching. And it's not that the physician has to do it. You can have a designated non-physician do it. So now Medicare is saying, hey, lifestyle coaching is really important. We want to pay for it. Before 2023, you weren't going to get paid for lifestyle coaching for obesity. Now you are. And the VA administration did another study and they said, hey, not only can we decrease the area under the curve and improve health span, we can actually increase lifespan. And that delta is 22 years of additional life and health. And so it's a pretty significant amount. And at first, nobody thought that you could do it in humans, but we've shown that you can. And it's not by adding statins, and it's not by changing their blood pressure, and it's not by the things that we normally think of. It's by lifestyle changes. And it seems that lifestyle changes drive 55% of the perceived value of healthcare, according to the federal government. So it's to the point, it's in things that you don't realize. For example, I have orthopedic surgeons that treat their patients, and they used to think that all of their polyjoint arthralgias were load-bearing. They always said, hey, we're going to do a hip or a knee, and it's because the patient wore their joint out. That's not the case. It turns out that 8 years before there's an x-ray change, you can measure serum markers and you can measure intra-articular markers, metabolic markers, and those are abnormal 8 years before there's an x-ray change. And that's a big deal. 8 years is a long time before you get radiologic evidence that documents that patient's going to have joint arthritis there. And what's more interesting is even when you replace the joint that you think is bad, patient still has pain. In fact, the vast majority of patients have polyjoint arthralgia. You fix one pain area and the other ones show up. And so then they have them in non-load bearing joints. And that really leaves the puzzle for my orthopedic colleagues, which is how we came up with Measura. There are a whole host of markers, but to give you a perspective, because this will be relevant for your practice, an orthopedic surgeon gets paid $1,378 for a total hip replacement. They make $1,430 for a total knee. They do 1,000 surgical cases a year. But in order to do 1,000 surgical cases, they walk away from 8,000 other patients. They walk away from them because those patients are metabolically deficient. They're overweight, they're pre-diabetic or diabetic, they're hypertensive, they have some other symptom that's poorly controlled, and they're walking away from those patients. So we've implemented our protocols with them to make their patients metabolically healthy. And so they're treating the 1,000 operative cases that they're doing, but then they're also chasing after the 8,000 that they didn't do. And if you look at that number, if you look at 1,000 patients that you treat with our protocols, just the Measura testing alone generates $840,000 for the orthopedic surgeon or for the primary care. If you add behavioral health and remote patient monitoring, you generate another $1.944 million. The system that we have is we put in all of the testing capacity, we put in the staff, we put in all the technology, and we split this fee with you. You keep 60% and we get 40%. If you add the behavioral health component, then that's typically split with you 50-50, and you use an RPM company, and you're working with some already. And what we do is we validate that the one that you're working with is going to do the lifestyle coaching in the correct way, and then you're going to use certified people to do it.